The prostate gland forms glandular structure completely surrounding the first part of the male urethra. The periurethral glands are embedded in the longitudinal smooth muscle of the proximal urethra. The gland lies posterior and inferior to the neck of the bladder, anterior to the rectum and posterior to the symphysis pubis and pubic arch. Base is the most superior part of the gland. Apex is the most inferior part. It is a chestnut shape or almond or triangular in shape. Size normal, dimension 3 cm long, 2.5 cm deep and 4 cm width. Normal volume is 20 cc, equivalent to 20 grams. In older men, more than 60 years, above 40 grams is considered as enlarged prostate. Structure grows two lateral lobes, right and left, or median, one median and medial lobe, three zonal and peripheral zone, transitional zone, and central zone. Medial lobe is the one which enlarges in benign hyperplasia. Peripheral zone is the commonest site for prostatic carcinoma. Lobes are ultrasonically indistinguishable on transabdominal scanning. Benign prostatic hyperplasia, believed to be an imbalance, usually begins in the fifth decade. Enlargement occurs in the periurethral transitional zone, compresses the central zone, and thins the peripheral zone so that most of the gland appears involved. May be asymptomatic, very common in men over 50 years of age. First symptoms is usually dysuria, frequency. Nocturia very common. Eventually urinary retention occurs, causing severe suprapubic pain. The clinical significance of benign prostatic hyperplasia relates to the degree of obstruction of the prostatic urethra, which can lead to infections and bilateral hydronephrosis. Benign prostatic hyperplasia elevates PSA. Ultrasonography 20 grams is considered as enlarged in older men more than 60 years. 40 grams is considered as enlarged. As hyperplasia develops, the transition more commonly occupies the prostate, termed as inner gland. Echo pattern of the inner gland is hypoechoic and homogeneous. Prostate appears overall symmetric, well-defined smooth margins depending on the severity.